Okay, so this video is about confounding. And what is confounding? The easiest way to explain it is to give you an example. So here we have a study, let's say it's a cohort study, where we are looking at the relationship between alcohol consumption and coronary heart disease. So we have two groups. We have a exposed group, and this group drinks a lot of alcohol, and we have an unexposed group which does not drink alcohol, drinks other things. And then we're looking to see whether this group has a higher incidence of coronary heart disease than this group. And if they do, then we want to conclude that that higher incidence of coronary heart disease is due to higher levels of alcohol consumption, or the exposure in this case. Okay, so we say we do the study, and then we find that the higher alcohol consumption group has high incidence of coronary heart disease, whereas the low alcohol consumption group has low incidence of coronary heart disease. And so we want to say, in this case, the relative risk is high for alcohol consumption relative to non-alcohol consumption. But there's a potential problem. So, and this problem is a potential confounder in our study. So we know that smoking is also related to coronary heart disease. And additionally, we know that smoking is also associated with alcohol consumption. And we notice in our current study that the people in the exposed group, those who drink a lot of alcohol, also smoke more than those in the low alcohol group. So when we are looking at the relationship between the alcohol consumption and heart disease in our study, we see that this relationship is high. We don't know whether that increased coronary heart disease comes from the alcohol consumption or the smoking. Okay, so it could be that alcohol consumption has no effect on coronary heart disease, but it's because people in this group smoke, and the smoking is what causes their high coronary heart disease. So this is an example of a confounding variable. And so you don't know which of these factors is the actual cause of the increased risk in this category. So what's critical in defining a confounder, a variable is a confounder if it's related to the exposure, so that if it's higher in one exposure group than another, okay, and if it's also related to the outcome, okay. So those are the criteria for defining a confounding variable. Okay, so here's the schematic that we're going to use to talk about these confounding variables. So we've got an exposure, which is alcohol consumption, and we see that this exposure is associated with an increased risk in coronary heart disease. Okay, so that's indicated by this plus sign. But there's a confounding variable here, which is smoking. Okay, and so smoking is a confounding variable because it meets two conditions. First, it is correlated with the exposure. Okay, so it doesn't matter what direction it goes in, so it's correlated. So this could cause this, or this could cause this, but these two are associated in some way. And the confounding variable is also associated with the disease. So smoking is related to coronary heart disease. So these two things are necessary, and it doesn't have to be a positive correlation necessarily. Remember that correlations can be either positive or negative, and they can still be significant. And so this can be either a positive or a negative association, but the point is that this is an alternative explanation for this causal pathway here. So even though we want to say that it's this is the causal pathway, alcohol causes coronary heart disease, it may be that that's not true at all, that actually it's the association of smoking with alcohol. So the alcohol itself doesn't really have anything to do with coronary heart disease. It's just that it's related to smoking, and smoking has to do with coronary heart disease. Okay, let's talk about another example. So here in this study, we've got a relationship between physical activity, which is our exposure, and myocardial infarction. So what we found in our study is that people who are more physically active are less likely to develop an MI. So a potential confounder in this study is age. So physical activity is associated with young age. I'm not sure completely this is true. I'm pretty sure it's true, but just for the sake of our example, we will say that younger people are more likely to be physically active. So there's a positive relationship there. And, of course, this wouldn't be a confounding variable unless it was also associated with the outcome. And so we also know that young age is associated with decreased risk of myocardial infarction. So this is a confounding variable for this relationship between physical activity and MI. So we're seeing a negative relationship here. However, this relationship could be caused by a confounding variable, age, because age is associated with physical activity. So people who are more physically active are also younger, and then youth is also associated with a negative risk, lower risk of MI. So this relationship here may be actually due to this relationship here. So this is a similar example to the one before. However, in this case, the confounding variable is explaining a negative relationship between exposure and disease. So you can see that it has nothing to do with whether the relationships are positive or negative. It's just that a confounding variable has an association with both the exposure and the outcome that can explain, is an alternative explanation for the direct link between the exposure and the disease that you're trying to argue for in your study. Okay, let's consider another scenario, and this time we have physical activity, and again associated with decrease in the disease, myocardial infarction. And in this case, we don't have age as a confounding variable because age is equal in the exposed and unexposed groups. But now we do have a difference between exposed and unexposed groups in terms of another variable, which is fluid consumption. So we know that the people who are more physically active are more likely to drink fluid and drink more fluid than the people who are less physically active. And so the question is this a confounding variable in the relationship between the physical activity and the myocardial infarction? And the answer is no, because there is no relationship here. So since there's no relationship between the variable fluid consumption and myocardial infarction, we don't think that that fluid consumption would influence the risk of myocardial infarction. And so because of that, this fluid consumption is not a confounding variable, since there has to be a relationship between the potential confounding variable and the outcome. Now, if we found out that there was a relationship between fluid consumption and MI, then this could potentially be a confounding variable. So let's just consider one more scenario. So here we have, again, our exposure is physical activity, and our disease is myocardial infarction. And in this case, we do have a variable that is associated with the exposure and the disease. So that is blood pressure. So we know that people who are more physically active also have reduced blood pressure, and reduced blood pressure is related to reduction in myocardial infarction. However, this is not a confounding variable. Why? Because it's part of the causal pathway between the exposure and the disease. So if any variable that's a part of the causal pathway is not a confounding variable because it's just part of the explanation for how physical activity and MI are related, or how the exposure in general and the disease are related. So those are, this video should explain what is a confounding variable and what is not a confounding variable. So the confounding variable has to be related to both the exposure and the disease, but not considered part of the causal chain between the exposure and the disease. And that's it for confounding.